Good evening, everybody. It's so nice to have you here again. So today, like we all know, we'll be discussing about drugs, the dangers of misuse, abuse, and addiction of drugs. So you know about Team Favorite Nurse already. So Team Favorite Nurse is a group of nurses, student nurses, in which we are giving back to the community and to our environment at large. Our aim is to promote healthier living, and we go to schools and communities and marketplaces to enlighten people and to give them ideas on how to improve and take care of themselves and their health. So today we'll be discussing drugs, dangers of misuse, abuse, and addiction. So I will introduce the the host of the show today, and she's the team lead of Civil Rights Nurse. Her name is Nurse Badakin Motunrayo Roda. So right now I'll be reading her bio. Badakin Roda Motunrayo is a fresh Christian graduate nurse from the University of Ilorin. She is a registered nurse, a registered midwife, and a registered public health nurse. Her interests are in public speaking, public health education, and awareness with health care to the grassroots. With same passion, she started her own team of nurses in late 2019, Team Favorite Nurse, with the sole aim of reaching a larger audience and impacting their health choices. The team has partnered with several non-governmental organizations such as Sanitary Aid, Aware, Female Around the World, amongst many others, also to help people make healthier choices. Rhoda and her team has reached more than 10 communities in Kwara State with the good news of preventing care and early intervention. So right now, I would love to invite our host to just say a little something to us. Thank you very much.
Good evening, everybody. It's so great to be here again this evening. I'm so delighted to have you in this webinar. And our primary aim is to see that you go home with one or few points about drug, the abuse, misuse, and addiction. They're quite different from each other. So, as she rightly introduced me, thank you so much, moderator Nos Adejoke Adeni and Badakiroda Moturayo, together with beautiful, handsome nurses. We make team favorite nurse. We are tasked, we are saddled with the main aim of helping people make healthier choices through how they live, what they eat, lifestyle, and many other things. So you can follow us on all our social media platforms.
Okay, it seems as if she has a network issue, but I'm sorry for not introducing myself. My name is Nurse Adeni Adejoke Precious, and I am the moderator for today. So, pending the time our host will be joining us back, let me quickly introduce the guest speaker for today. The guest speaker for today is pharmacist Joshua Badakin. Pharmacist Joshua Badakin is a licensed pharmacist and a member of the Pharmaceutical Society of Nigeria. He is a passionate healthcare professional, operations leader, and entrepreneur dedicated to expanding access to medicine and quality healthcare in underserved communities. Can I be heard? I would love to see your comments in the comment section. So, in underserved communities with a background in pharmacy and practical experience in health tech, supply chain operations, and the non-profit sector, Joshua has proven track record of leading high impact initiatives that drive real world change a committed advocate for social justice, youth empowerment, and drug abuse prevention. Pharmaceutical expertise to raise awareness about with anti-human trafficking organizations and mentors youth-led NGOs guided by core values of integrity, collaboration, and resilience, shaped by both adversity and achievement. So, right about now, I would love us to welcome pharmacist Joshua Badakin to the show right now, and I would love us to welcome him with our emojis, with a round of applause and our love. Let us please welcome him.
Thank you so much,
Good evening, sir.
Adijoke. Good evening. How are you?
I am doing well. How are you too?
I'm very well, thank you. And thank you for the astounding introduction. I really appreciate it. I see what you guys are doing in at Team Favorite Nurse, and it is worthy of applaud. It goes without saying that you guys are doing wonderful work. I follow you guys, and I must say kudos to you guys, and well done. So, without further ado, I guess we'll just kickstart. We had a bit of technical glitch before we started. Apologies for that. And I'm very certain that we are going to really enjoy our time this evening, right? The topic that we are actually having this night is a very important, pertinent topic to our society, and um, it's a timely one. And when they shared with me, I say, okay, this is a very wonderful one because every single human being on earth knows someone who must have misused drugs, abused it, or is addicted to drugs, illicit drugs sometimes, right? If you don't know someone, you know someone in your community not so far from you. So, why are we talking about this? Um, for context sake, about 36 million people have been reported to be a victim of drug um, addiction, right? And that's for context for people who are in Nigeria. That's basically, or who is familiar with the terrain here, that's basically times two of Lagos state population. So as much as the population in Lagos State, 36 million people have addiction, which is times two of that. Lagos is about 15 million plus, and that's the data on just amount of people who are suffering from um, um, this problem, right? And it is also very germane to say that I could even classify this as an emergency, a global health emergency that we need to talk about. And without further ado, I'll just cut to the chase. So, understanding misuse, abuse, and addiction. So, I'll go and I would like to talk about the misuse first, right? Misuse basically is the idea behind you someone taking a medicine that is not meant for them because they've not even gone to see a medical practitioner, a licensed one, particularly a doctor in this case, because in this region, a doctor has to be the one to prescribe for you. If there's any need for him to now um, refer you to any other department, he will do that. So you have to at least see someone first before you use any drug. So it is in the sense it's said that it's an appropriate inappropriate use of medicine. So it can come in different forms. Three forms I've enlisted here: wrong dose, when you take a medicine that is not they told you to take, but you took it the wrong way. For example, they gave you paracetamol, and you're supposed to take paracetamol 2, 3 times daily, but you went ahead to take it um, maybe more than, because you are feeling more pain than ever before. It's not supposed to be like that. You're supposed to take according to your pharmacist actually advised you to take, right? And if you're taking it for the wrong reasons, I'll give you an example. For example, let's say let's use for example Chiamaka. Chiamaka sees that, okay, a friend of mine is was having pain last night, and she used a particular drugs. Let me go and ask her some particular drugs. Let me go and ask her, and maybe she can give me, because I'm also experiencing pain. I have to alert you there that that's a wrong practice. You should actually see someone who is a medical practitioner, a licensed one, to actually know exactly what is wrong, because there are a lot of problems that could result in us that can be causing the pain that you are experiencing, right? And Chiamaka takes tramadol unknowingly and feels better, or little does she know that she's now taking um, a drug that is controlled, and that can easily be addicted to. You see that right there? She can be addicted to tramadol. Okay, she's like, okay, I feel good today. Okay, let me try it again the next time I'm using I'm experiencing pain. And guess what? She continually takes this tramadol. Tramadol is even known to be easily for someone to be easily addicted to. So before you know it, she's now very much dependent on this drug, which is not supposed to be. This is as a result of what? Drug misuse. Another one is, like I said, taking someone else's medicine is not the best, right? And another type of it is the third one, which is altering method of use. You're supposed to take this thing by swallowing it. Someone went to crush it and snort it, crush and snort and sniff it inside. That's not how it should be done, right? You're advised to take it the way you are supposed to take it. And mind you, drug misuse doesn't really, you might not even really know that you're doing it wrongly. That's the reason why you have to ask from the practitioners. And it's very, very important, right? Because there are a lot of drugs that could even be contraindicated in your particular disease that you are having. But if you do not know, you just take it and you are just experiencing even worse experiences, side effects or adverse effects as a result of taking that particular medicine, right? It's not something we want, right? So thank God for this educational sessions like this, where people can actually talk about this and know more about it. And I think if you want to do well by your neighbor, you could share the links with them so that they'll also be educated. I'll still talk much about educating people, prevention, um, which is always known to be better than cure, right? So I'll go to the next one. As I've explained, drug misuse is just basically either you taking the wrong dose, taking the for wrong reasons, or taking another person's medicine without knowing what's because of the fact that you have similar um, symptoms is not a very well founded reason for you to take them. And another one I just shared with some people in my community recently. And another one is taking, you have to be wary of the product that you are taking. Check everything very well, lest you go and take medicines that have expired. And it's another form of misuse because you do not know. It doesn't have to be intentional, right? It's a misuse, right? So because when drugs are expired like that, it does work that it's not supposed to do in your body. It can now even counter what it's supposed to do. Um, so that's it right there. So another case we have here is drug abuse. We need to define this as well. Drug abuse is essentially used to achieve a high. So when you see people around you, maybe people who we normally know them as some gangster around here. Some people are not gangster, but they are just already used to abusing these drugs by achieving high, taking drugs like tramadol. You see some people I'll share a personal experience when I was working in a pharmacy. I saw quite a number of guys came around. They were fighting. They are buying this particular cough syrup. I will not mention the name of the cough syrup, right? But they were buying it, and it was. I was curious. Basically, I wanted to know why they were so into that, and they were not buying it in small quantities. I later got to know that that particular product had codeine inside. Codeine is known to be now in Nigeria is a control drug, and it's not supposed to be taken anyhow because it will swing your mood. It will make you achieve a particular high that you're not supposed to achieve. I'm still going to get more to the neuroscience of how addiction comes in, but we are just defining, and I want to let you know that this is how people just intentionally abuse. In contrary to misuse, is abuse is intentional. It's actually intended to make them feel a particular way, right? And the number of drugs that people use that way. You see people use narcotics. That's the reason why you see NDLEA chasing people around because of they've probably they are in custody of medicines, drugs they are not supposed to. However, these drugs are not particularly bad in and of themselves, but when taken in unprescribed fashion, that's when you get an undesired effect. So that will now make me segue to the next point, which is addiction. Addiction is the main culprit here, is the Elvis in the building, right? So it's a chronic disorder. Basically, addiction is a chronic disorder. It's a brain disorder whereby this person has a compulsive drug seeking um, attitude because the brain is already messed up. You see that someone who takes, for example, methamphetamine, or let's use methylene methamphetamine, which is usually called ecstasy. So somebody takes ecstasy for the first time, he achieved a particular high that he was like, okay. And guess what? For context sake, since we are talking about addiction, it's good for me to just chime in a little bit about what it looks like in the brain. So when you have a very good day, when you have a normal day, let's say for example you have a normal day, the amount of dopamine, there is a neurotransmitter called dopamine. It's a we call it a feel good chemical. It's basically responsible for pleasure, motivation, and all those good stuff you feel when you are eating your favorite meal, or you're in a social gathering with your friends, or you're basically talking to someone you like. Like a friend of mine was literally speaking with somebody he liked, a girl he liked recently, and was just laughing and smiling before I entered this call. So I'm sure he will be listening to me. So your mind would definitely your brain releases a dopamine when you are feeling good. Guess what? When you are having that type of feeling, the amount of dopamine is usually around 100 nanograms per deciliter. That's what you have on a day that you are very, very, very you are happy. You understand? You feel good. You're around your family and friends. You're really happy. But days that you are not really feeling good, that maybe you're not having it right, it's high like 40 nanograms per deciliter. Guess what ecstasy would do? Ecstasy would give 1,100 nanograms per deciliter release of dopamine to the person. So that's how trite um it cannot be compared to what was experienced even when you are really happy. So that's like more than 10 times ecstasy, joy that you will feel in you compared to taking it when you are just eating good food, which is okay. So when such person have experienced such good experience, the person wants to try it again, and because our the way our brain works, quantity of it the next time will not be sufficient to achieve the same level of experience. And that's where tolerance comes in. The person becomes tolerant, and that amount that you use the first time will not be enough to achieve that same experience of joy and good feeling and pleasure that the person had. And there is something they call, I don't want to bug us too much with the neuroscience and the etymology and everything, but it also it's very important for us to know that when these things happen, the brain now starts to basically reduce receptors and even dopamine release so that it can manage, you understand, it can make sure everything goes well, because there's the way God made our system is that when there is a surge in something, we tend to find equilibrium. You understand? So in a way, for the brain to find a level of equilibrium, it's basically reduces dopamine release whenever that amount is taken, and receptors that will receive those dopamine to make that high state happen. So what now happens is that the person will now crave that experience so much that they will now increase that amount they are taking. Before you know it, the person is now dependent on it. And when dependence coming, is a scary thing. Dependence is a scary thing because it's basically when you start taking it, if you withdraw, you will get something we call withdrawal symptoms. This withdrawal symptom is what you experience when you stop taking this medicine or you're not taking it as you used to. So now, for context sake, when you don't take this medicine again because your body, when you don't take these drugs again because your body is already used to it, guess what happens? The 100 nanogram per deciliter that you would have when you are really happy without any medicine, any drugs, would now come down to 20 to 30 nanograms per deciliter on a normal day. See now, you see why the persons who are into drugs are now into drugs. And it's I need to put this disclaimer out there as well. I need to put this disclaimer out there that um, it is not a case of it is it is not a case of that we it is not a case that these people are necessarily not good people, but because they've experienced such an amount of hype that they cannot bear it anymore. That's why you now see um, morally unpalatable things they do. Some of them might be morally and they might be fighting with their wills generally, but sometimes the thefts, the bad things that you see them do, the killing they will do rather to get money to buy those things, is as a result of the amount of craving they've put themselves into. So, like I would like to quote someone, Benjamin Franklin. He said, "The best that he said an ounce. That's the money, like the type of currency. An ounce of prevention is better than a pound of cure. You get it right? A pound of cure. So it's better we prevent. So the best way to actually not be a victim of this is to prevent, to avoid it. And how do we avoid? By education. I'll talk more about that much later. But it's very important that we put some background to things so that we understand what exactly we're talking about. What exactly we're talking about. Um, so we talk about compulsive drug seeking. Now they're looking for drugs that they take because it's a brain disorder. It's no longer something that they can do at their free will. It's now that the brain is asking for it. So, and I think every health and also every person should also know that there is a need for us to what to um, be also aware, not to stigmatize these people, because stigmatization will not help anybody. It will make them even go downhill. And thank you for the next slide. So um, so the next one is what are the consequences of of these things of addiction. That's when you have them come out with um bad what's it called, criminal activities that you don't want, and the accident, unsafe sex, all those things that we see people do around, gangster people just do intentionally, being thugs, because they know that that's the way they can actually um, fund that kind of lifestyle, right? A person would have a strained relationship, whether with family or with loved ones or with partner. Isolation will start happening. They would gravitate towards more towards people of their kind. So you see that right there. Economic burden would now start happening because of these drugs are mostly very expensive. Then you see them doing whatever they do. For example, a mother, someone, and the reason why I'm talking about this is we have had pregnant women. We've had not only male figures that we usually would typify this kind of situations to have serious addiction issue, drug addiction issue. So it's not only to the things that we already, the familiar ones, the stereotypes that we have. No, we have an example of somebody who spent over 150,000 pounds on cocaine, and the children they were not feeding well, the education was suffering, and all of those things. So you don't want all those experiences. That's why we're talking about it, and that's why it's good to educate people, particularly the young person. I also want to add this layer of thing to it. The reason why it's particularly important for the youth is because this reward system of the brain, the dopamine and everything that I talked about earlier, it's called the reward system. Is literally what the reason why the body sees that type of um, the body likes those type of things. It's like an evolutionary trait whereby, okay, this thing that makes me good the last time, that made me survive the last time, let me do it again. So it's that kind of reward system that the brain understands. But little does the brain also know that it has been hijacked. We call it hijacking of the brain. It's no longer the things that it's used to actually taking that is now taken in. In fact, as a matter of fact, some drugs will mimic the dopamine to be able, like methamphetamine would mimic dopamine, right? To cling to those receptors and act. So because of that, we need youths to know more that they are more have more tendencies towards being susceptible to addiction than even older ones. And that's the reason why, because what their own reward system and those system that makes addiction happens faster with young ones, younger generation, teens, youth, right? So that's why we need to share this information. So overdose risk happens, and when overdose happen, you know what can happen? The organs starts suffering. Death, as a matter of fact, can ensue because of overdose, right? So next slide, please. So factors and causes. These things don't happen all by themselves, right? They happen um, because of there must have been some introduction somewhere. These causes can be as a result of peer pressure. Um, Males are known to be um, um, to be more peer pressured into taking drugs than females. However, females, when they start taking, have more of more of basically having not so palatable experiences when they start. They they go deeper than guys. They can't tolerate, they can't stabilize easily, right? So but men still tend to start it faster. Right. Family history, when you have genetic disposition to it, predisposition to addiction. So we are different. Our physiology is different from each other, right? So, but some people when they take this, when they take a little pint of anything that can be illicit or can be controlled, they easily get high and you start seeing them do anyhow. That's because genetically they are have this predisposition to it and they should not be even taking that. It's not for anybody, but some particular group of people even respond even faster, right? Mental health condition, yeah, we have co-occurring codependencies, comorbidities, basically. If like anxiety and depression can even make it worse. Like, so you now see people wants to hide because they have anxiety, which is not supposed to be so. There's a medical way to go about this, right? Stress, trauma, lack of supervision. Lack of supervision can be from health workers, can be from guardians, right? Can be from people who are supposed to be watching this, either the teens or even the person that is already into this thing that wants to come back and doesn't want to relapse. Lack of supervision can be a problem, right? Media influence, the era of TikTok. We are in the era of TikTok, and we have to be wary. You have to ask questions. Youths have to learn how to ask questions. You don't just see anything online and consume. Somebody reached out to me about some drugs that is actually good for something they wanted to use. I was shocked. They got it from TikTok. They screenshot the medicine to me. I was like, this is actually not correct. So we have to be very cautious and be wary of what we consume physically and even in the media, because these things can be a lot of problem. And once you start taking them unknowingly, like I said earlier, it might not be intentional. Misuse can lead to addiction later. So that is where you need to speak with your health provider, licensed one, as a matter of fact. Easy access, availability of these things. I can easily get this cough syrup now. Should be it's here. I can get it. It's even over the counter drug. I can easily get it. I don't need prescription. Shouldn't do that. Don't harm yourself. Yeah. Vulnerable groups, like I said earlier, teens, adults, and young adult trauma survivors have higher risk of having this problem. Right. So next slide, please. Please, I want to be sure that we can hear me. Can we hear me? I think okay. Please, can you confirm you can hear me? Ms. Muturayo, can you hear me?
Hello, I can hear you, sir. I can hear you.
Great. I just want to be sure. Thank you for that. So, yeah. So, can
We
you hear
can hear
me?
you. Can you hear me, sir? We can hear you.
Yes, I can hear you. Great. So, thank you very much. Please, can you hear me? Yes, I'm actually. Next slide, please. Next slide, I'll just check it from my end here. Um, so we'll talk about the signs and symptoms of this misuse and abuse of addiction, misuse of drug. Basically, physical indicators will include drowsiness, dilated pupils, constriction in the pupils, frequent illness, weight fluctuations, because of the fact that these things, if you're taking a drug that is makes you that stimulates you, for example, you might not really you don't get hungry because it has messed up with your system, it has hacked into your system, whereby you won't get hungry easily again, leading to a weight loss. So that's where the weight fluctuation might now come. Dilated pupils. That's why when you look at some people, you look into their eyes, they'll be like, "What are you looking at?" Because they know exactly what they've done. And their eyes, the pupils are already telling us details about what is happening. So those are the signs that you look out for and you know that there's a problem. It's not all of them that's like that. Sometimes when you look out for these symptoms, signs and symptoms, you know exactly that this person is into something and needs um, rapid medical attention, frequent illness, drowsiness, and all of that, and behavioral changes like increased secrecy. This person is no longer opening up their confidence, the people around them, unexplained financial problems happening, significant drop in motivation, poor academic or work performance, withdrawal from loved ones. academic performance. Like for example, someone who used to be very good and automatically some reason the person is no longer doing well, and all it's adding up. The person is not taking. It's taking. You notice that okay, weight is happening, loss is happening, dilated pupils, contracted pupils. All of those things, you just know that there's a problem. Psychological shifts will happen, like heightened anxiety, profound depression, erratic mood, swings, period of paranoia, distrust will happen. They don't trust anybody around them, and sometimes can be characteristically aggressive. You understand? So, look out for those signs, basically. So, and it's also important now to also talk about without I don't want to take too much of our time. Unless I have some 40 minutes. So, the effect it will have on other people. We have to talk about the effect that it will even have on other people. We have analyzed the effect it can have on them, but even on the people that are not the users. You understand? People it can also lead to. So if someone is smoking around you, second-hand exposure, we call them passive smoking. When you are just passiving it, and you're not taking you're not the one taking the tobacco. Somebody around you, because you stick with them. Guess what? There are 7,000 chemicals that are inside those things that can 70 of which can cause cancer. 70 of which can cause cancer. So you don't want to be passively taking these things. Maybe you are just there and you're just guess what? There is no benefit for passively or being around somebody that is smoking. It doesn't have any benefits. Rather, it even has a lot of problem. And somebody who is pregnant should not even be around them because you run a risk of having a number of problems. Neonatal abstinence syndrome is there, which is a very, very critical one. You don't want to have that. It has a lot of mental problem, behavioral change issues with a child that is even a newborn child. So you don't want to have that public health burden. The reason why I'll pause to say this. The reason why we all need the, the reason why we all need we should speak more about this is because okay, let me cite an example. Someone who comes to your house and boggles your house, the person most certainly would most likely is not somebody who you know, right? Maybe some of them might be in your neighborhood, but they are not in your family. That's the reason why you should know that you literally have to be your brother's keeper here, because the effect that will have on you might not be you might think it's not might not be a direct effect, but it will later have an indirect effect on you one way or the other. So when you say this, you are not only saying this for someone, you are also saying it for yourself. Because if they attack someone you know, they're already attacking you. And the best way to avoid this is to educate. Imagine you educate someone or you talk about this, you were able to help somebody avoid this, the misuse or abuse of drug. You've done yourself a lot of service while you are doing another person. So we literally need to check up for other people in our communities, because if there is um any ripple effect that would have to have on us as well, because someone who is a nuisance to a terrorist is a terrorist not to himself alone, but even to the people around them. So it's important that we take note of these things. Please, can we go to the next slide? So let me just. It's good. I want us to type on the comment section that you can hear me. So if you can hear me very well and you're following, you don't know whether I would ask you any question or not. Or let me know in the comment section that you can hear me loud and clear. So be sure I'm not talking to myself. You can hear me. So all right. Um, Real life stories include cocaine addiction among mothers. It's not prevalent here in Nigeria, but it's a thing. right? And we should look out for that. We should look out for that. And it will lead to a lot of problem effects. To talk about that, it leads to a lot of heart issues, um, lung issues, emphysema, what have you. But financial issue is there. Psychosis. You don't wanna. Nobody wants that by God's grace. So ketamine devastation to happen. 29-year-old suffered painful bladder disease, right? Incontinence, liver failure, near death because ketamine is not supposed to be used anyhow. When you use it anyhow, the pain in the bladder and the incontinence, the person will not be able to hold their urine basically, right? Cocaine induced psychosis also can lead to some form of paranoia, schizophrenia when you take cocaine excessively because the body takes while I said that the dopamine in the brain is also like adjusting the receptors and even the body is not releasing enough dopamine and all of that. There is also a place for there's also a place for also the organs to asking questions that what exactly is wrong is happening here. They want an explanation because it is already it's already having the the organs also have an amount of drugs that should enter into them at time. But if that's not the case, then there will be an organ issue. Then there will be an overload. There will be an overdose. Nobody wants that, right? So yeah, nobody wants the so nobody wants the so you don't want to excessively use these drugs because nobody should even use them in the first place unless it's prescribed, right? It's not, I'm not a prophet of doom, but these things are real and we don't want to experience them. That's the reason why we have to emphasize to the public, anyone around us, let us be the evangelist of these things. Right? Talk about them. Right? So another point to take to also talk about is treatment. I'll be remiss to not to talk about the treatment of these problems. Although this might be more towards for the consumption of more of health workers, but it's also very pertinent to talk about. And detoxification is one of the first things that we do. We detoxify, we find a way of ameliorating, find a way of reducing the symptoms, stabilizing the individual, leads to the therapy, using medications, for example, medications for addiction treatment, which includes methadone, naltrexone. Methadone, for example, is methadone and naltrexone, and even bupropion. You understand? Um, these products are these products are literally these products are literally um, these products are literally these products are literally um, these products are called opioid. Sorry for the diversion. I was a bit distracted. Are called opioid agonists, right? They help in reducing the symptoms that are experienced as a result of taking opioid um, related drugs, right? So they help to reduce the cravings because when the cravings are reduced, you the person thinks less about it. You think about other two things. So when the amount of temptation has reduced, definitely the urge to actually go and buy it will also reduce. Those are the methods that we therapy that we use. There are also nicotine chewing gums and patches that can help also for that, right? Um, Example is although alcohol is not a- but it's also like people misuse that. Disulfiram is also used for that. Some people, when they take it, when they take something like that, alcohol is now bitter in their mouth. So when they don't want to take alcohol again, right? So things like that, when you use them, they help you. They help the patient actually get better. Behavioral therapy, for example, cognitive behavioral therapy (CBT) also helps. It's literally um, CBT is literally like it's psychotherapy basically. It's for someone to be able to the psychotherapist to literally talks to the person, make the person understand how this thing works. They understand how this thing works. They explain to them. So the idea is to make you um, think right, so you can do right. So that's just the idea behind CBT, called cognitive behavioral therapy. Motivation, counseling and support groups, right? When these people, when you counseled by professionals, right? People, and even like testimonies of people around them, people who are also were also in that situation, or they are already um, going into that situation. They lend their hands, you understand, to be able to also share the experience that without that's also testify to the importance of communities when it comes to things like this. Treatment of co-occurring disorders too. So this can be done concurrently, right? So they will have a holistic, long-lasting recovery, basically. I do not want to take much of our time. Aftercare, relapse, and prevention
Well
is
done,
also very
sir.
very
I can't really hear you. I think I don't know what's going on. It's not really clear.
Oh, for real? Since
Yes, it's now
since
better now.
when?
For about five
It's
minutes
better
now.
now, right?
Yes, it is. Yes,
Oh,
sir.
okay, okay, that's great. All right. So aftercare relapse prevention is also a thing, right? So that the person would not relapse, so that all the work that has been done will not be to a waste. So it's important that we also basically, as professionals who follow up on these people, do all the necessary follow ups. So and all of those personalized relapse prevention plans that are very important for sobriety and building healthy, stable life, right? So I would love to stop here because, but the bottom line is, like I said, prevention is the best cure. An ounce of prevention is better than a pound of cure, like
Okay.
Benjamin Franklin would say, right? So early intervention, evidence-based treatment, harm reduction. It's not really as complex as we think. It's just for us to show sympathy towards people that are already there, not stigmatize them, know that it's a disease for someone who is addicted, but also find help for them and find a way to sensitize people and younger ones that don't have it already to avoid it. And to misuse, do not take anybody's drug. Pelumi, if you are hearing me, do not take anybody's, don't collect anybody's medicine. Go to the hospital and be diagnosed first before you can take any medicine. And that will be from
So,
advice by your pharmacy. Dio, you don't have the same disease as the other person and take it as advised. I don't want to be calling names, but I think I'm already calling many names if you are listening to me. So that's basically it. And check all the necessary details, the expiry dates, and all of the information that needs to be checked before you take any medicine. And I'll just, I think it's fine to call it a quit here, to stop here, and to probably take any question if there's any. Thank you very much, guys, for listening.
thank you so
Over to
much
you,
for
Moshana.
Josh. We are so glad to have you here. I want to say a big thank you as a team from Team Favorite Nurse. We are so glad to have you here. Thank you so much for the wealth of knowledge. It is very, very important to always invite the people that are in charge, not just say, oh, we have someone that can speak, but we should get people that this is their This is what they do. That's why we have you tonight. Thank you so much, fam. Josh, we are so grateful. Thank you so much again. And without further ado, we have to take
You're
your
welcome.
questions. While we wait for the questions in the chat box, there are a few questions that I might want to like just ask you, sir. And number one says, for someone who take drugs to help academically, especially during exam periods as students, but if this person stops immediately after exam, is it still drug abuse?
Okay. Let me guess your question very well. You said the person who takes a medicine for to do what exactly during exam? If I may
To help
understand you.
during exams, like maybe caffeine, all this Nescafe that contains caffeine, or any drug to just relieve the stress, to hasten up reading, and some other drugs that we cannot mention here that students use to like feel very on time, on track, and very high, very fast to cover up a lot of things. We always have a lot of things to cover during exam period. So when these people stop after exam, is it still drug abuse?
Yes, it is, Rhoda. It
Okay.
is. You're not supposed to take any form of drug to enhance anything. Your mind, your brain is already getting used to those things, and the person might even have withdrawal symptoms that, like I
Symptoms.
said. So it is always very nice to read by yourself, know yourself. If you are early morning someone, if you're an early riser, if you are a night owl, as they call it, you'd study yourself and you will still get the best out of it regardless. So it's very, very important that you just know yourself and don't take anything that will help stimulate your ability. No, don't,
Avoid
nobody should do that.
stimulants.
So misuse, in fact, that's a classic case of misuse, regardless of how you want to think about it, whether it's used for examination purposes or not.
Thank you so much. So I'll move to second question. For someone that's been addicted to a particular drug for a while, the person tried cutting it off, but still cannot completely be free. Is it possible for someone to be free or to overcome drug addiction? Yes, sir.
That's a very good question. Thank you for that. Um, it is very, 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 very possible. It is fixable, and I talked about methadone the other time. Methadone has 75%
Okay.
if rate effect, like it can be very 75% effective, right? Naltrexone, for example, is within 65 to 75% effectiveness, right? And so it's treatable with all the procedures that were already out. It's very
Mentioned.
important to follow up, yeah, depending on the type of addiction, though, and the person, and the gender, and the number of things. But it is possible for the person to achieve sobriety, the person to get back to normal with the assistance of the drugs, the medicines that we use, medicine assisted treatment that I talked about, um, counseling, all of those behavioral things, communications with them, taking them out of what is actually causing them to have that. But is it treatable? Yes, it is treatable. But would it take time? Definitely. And depending on the person as well, depending on how willing they are to actually get out of that state of addiction.
It's first
So
start
that's
with
it.
them. Yes, sir. Thank you so much. We still have a lot of questions, but because of time, and we would like to stop here. Thank you so much, sir. Thank you so much once again. Thank you, everyone, for joining. Key take home from this webinar is that it is better not to start at all. It is better not to start at all. Maybe you have friends that are telling you, oh, let us use this medication to be effective at work, in school, or wherever it is. It is possible you can function effectively without the help of this medication. So say no to drugs, whatever it may be. And don't let us see drugs as only hard drugs. That is a misconception. We even wanted to like topic for tonight to be prescriptions, because most of the times the prescription part side of these drugs are being sidelined, such that you have been prescribed to use paracetamol, but paracetamol of maybe 1 gram thrice daily, you end up using 1.5 gram. That is abuse. Yes, that is abuse. So abuse can be from whatever kind of drug, and maybe you unintentionally used lesser or even more than. It is also misuse. Did we get it? And addiction is when you started using from 1.5, then whenever you feel pain, 1.5 does not do you again. Like 1.5 is not able to like help with the pain again. You have to increase it to 2 grams or even more than. Then your, that's what we call tolerance, that your body is not tolerating that the prescribed dosage again. You need a higher percentage to be able to get the level of satisfaction or effect as you normally supposed to get. So many other take homes like cognitive behavioral therapy, psychotherapy, um, counseling. Yes, whatever drug abuse, whatever drug that you are abusing or you've misused in the past, seek for counsel. Ask the people that know that are in the field, especially pharmacists. Check up with them and say, oh, this is what I've been doing. It might not be quite easy because of oh, I feel that people will stigmatize me and I might not be accepted, and people will look down at me and say, oh, you've been abusing a drug. I know, but the stigma is now better. We are raising an awareness to help with that. So whatever people will say, it is your life after all. So please be able to be confident to walk up to a licensed healthcare practitioner and open up to them about whatever you are going through. And drug abuse is easily treatable. It first starts with you. If you are willing to comply to the rehab or whatever it is that your a pharmacist might prescribe or healthcare worker might prescribe, if you are willing to yield to it, don't worry, you'll still be out of it. I know addiction is not quite easy to break from, but it is possible. Yes, drug abuse, misuse, addiction, it is very easy to break away and break out from it if you are really, really intentional about doing it. And that is all from us tonight at Team Favorite Nurse. We're so grateful and glad for you, to you for being here rather. And we know that it has been a long day. Please take time to rest. And we have a big news coming for you in the month of August. Even before then, July 26th, we'll be having physiotherapist Ayo Daily. We'll be talking about pains, spine pain, back pain, and leg pain. I cannot wait to see it. It's going to be a loaded session just as this. So please invite family and friends, people that have been complaining of pain, whatever in whatever region of their body. We are bringing licensed people that know their onions to this platform. So please make it a date with us. And in August, we have a big news for you guys, and we want you guys to participate. So as you see all this information on our meeting room, please share and be prepared to actively join. Thank you so much once again for joining everyone. I see you, ABG, Abigail Bigod, Mama Nusheza, Adeoti, Inyolua, Nurse Florence, Nurse everybody, my colleagues, my family members. I want to say a big thank you to you again, to our wonderful moderator. I'm saying a big thank you to the Team Favorite Nurse at large. These people are the people that make everything work and happen. I celebrate you guys. You mean a lot to me. Thank you so much once again. I'll see you on the 26th of July 2025, still on this same YouTube channel. Thank you. And you can always go back to watch again. Yes, and please share with other people. Have a great night rest. Bye.